literally when we started, I don't even, I know there was no budget. It was a blank piece of paper. The informed consent was probably 2 pages. The case report forms were triplicate contact paper, and the indications and the protocols were simple. You came in, and this goes back to like 1982. You came in, you sat down, we'd take your blood pressure 3 times, we'd weigh you, you'd have some blood tests, we give you, blinded medication, you'd come back, several times, we'd repeat that, and that was the study. Um, and that's the way it was for, a good number of years. And then they got more and more complex. We started adding, different classes of medications. Then you had, lipids, you had the statins, the protocols. Now they wanted to start looking for other outcomes, other adverse events, multiple endpoints. The contracting and budgets became much more difficult. We now have a budget team, we have a contract team, we have a source document team, we have a quality assurance team. In the good old days, it was Dr. Silverman, myself, and Maria. That was it. This goes back to the fact that I've had 2 jobs since I started. I started out as a family physician doing clinical research, and then I ended up running a large medical practice and running a large research site. Um, 2 things that I absolutely love, that I still love. It's given me a chance to meet a lot of new people. It gets me the chance to learn about medicines and vaccines while they're in development. When we do learn about this, you go much more in depth into the pathophysiology of diseases and the causes of diseases and the treatments. So it's always been learning, which is part of the fun for me. And I think meeting the people, across the industry that have dedicated their lives to really helping others, not just with medicine, but to finding new treatments and cures, is the best part.